Hi, everyone. Dr. Daniel Klauer here from the TMJ and Sleep Therapy Center. So my specialty is focused on treating patients with craniofacial pain, headaches, migraines, snoring, and sleep apnea. And so my expert tip today is going to be talking about cone beam scans, looking at those and getting comfortable reading them. So I'm going to quickly kind of go through what I look at and how I got comfortable doing that and show you a thing or two. So typically, as I open in the scan, I will orient to make sure I'm looking at it from as symmetrical lineup as possible. So I'll center some things here. And then typically, I kind of go through the same order as I read. And I will kind of start at the tip of the nose here and kind of walk my way back. And so looking at the view of the structures, I go back, and then I can notice things like this deviated nasal septum down here, the turbinate hypertrophy, and the bone spur that's kind of hanging out in the floor of the nose. And then we'll see in the maxillary sinus here on the left, we'll see that congestion. It looks like a little mucus retention cyst, and then also some congestion in the ethmoid sinuses. So as we scroll through, we can look at those structures. I tend to look at one structure and then we'll pan back through to make sure I don't miss anything. So now at the sagittal view up here on the top right, I'll pan through and I'll look at all the teeth, look at the root apices, make sure I don't see any periapical pathology, any root resorption or anything like that in the teeth. Then typically I'll look at the cervical vertebrae, see some early degenerative changes down here in the cervical spine. I will make note of that as well. And then we'll kind of make sure I just peek at it from all dimensions, looking for gross asymmetries or any abnormalities that jump out at me that have me concerned. Look for regions in the external and internal carotid arteries for any calcifications, and just make note of those. We do look at the airway feature, not diagnostic by any means, but just at least helps us to see, okay, what does the anatomy look like? And so we can map that out and take that for what it's worth, as we know it's upright awake, but then we can comment on that. And the volume render is great for just kind of looking at a macro view of what's going on and what the symmetry of the bone looks like. And mandibular plane angle, we see some pronounced gonial angles there. We'll see some calcifications in the styloid process area. And good to look at this view if you're doing an ortho case, look at crowning, any crowding or root angulation and stuff like that. And then kind of lastly, and often most importantly for me, is looking at the TMJ. So I will take our view boxes here and I will center them up on the condyle. And what I can do is I can hold the shift button, and that allows me to toggle. And then the control button with picking up allows me to zoom in. And so what's nice is I get a true three-dimensional view of the jaw joint. You can look at the spacing of the condyle. And so here we have the glenoid fossa, the articular eminence, and then the condylar head. And we can comment on any pathology or abnormalities of the bone, some flattening here and tiny osteophyte there as well. But that's kind of what we can look at here. And this is great to show the patient. And the pano view is what patients are commonly used to seeing. And you can do a automatic pano, or you can kind of manually create it as well, depending on what you want to look at. So the way I got comfortable reading these is would go through multiple of them over and over and over, but I'd send them to a radiologist. So then you take your radiology report, see what they found, and take your report, see what you found, and then compare it to. But I'd say it's best practice to look at it yourself first and have a system of which you go through. And you can just take the template that the radiologist uses by body part and make sure you touch everything. And then you compare those two notes. It's a great education. It's better than having to lug away and go to a course, and then you're actually learning on your patients. So I would just extend that cost of the radiology read to the patient and tell the patient they're getting it read by a radiologist. And then my training and education would come in reviewing that report. So expert tip today would be go through the CT scan in a systematic approach so you don't miss anything. Have a document that you use to follow and mark those areas, and then work with a radiologist to compare notes, train yourself, and then have a resource to reach out to if you should need anything. So Dr. Daniel Klauer here, and hope you enjoyed that. Thanks.